Hello everyone, welcome to the webinar. My name is Jordan Stark and I'm part of the marketing team at Canadian Fertility Consultants. First off, I would just like to thank all of you who are taking the time out of their day today to be on the webinar. This webinar will be addressing surrogacy.
In listen-only mode.
First off, I would just like to thank all of you who are taking the time out of their day today to be on this webinar. This webinar will be addressing surrogacy in Canada, specifically ongoing solutions in response to COVID-19 concerns. We have 4 speakers with us today. We have Dr. Daneshmand from San Diego Fertility Center, lawyers Ellen Embury and Rachel West from Carbert, Waite, LLP, and CEO of Canadian Fertility Consultants, Leah Swanberg. Before we get started, I'm just going to go over a few housekeeping items. Number 1 is that we know everyone is at home right now, so in the event that you have any internet connection issues, please call in using a phone. I ask that you please note the phone number and access code located on the bottom of the graphic on the screen right now. This number is also in your email from GoToWebinar. You can call in using this number so you can still participate. Item number 2 is that we would like you to be aware that we are recording this webinar today, and everyone who registered will be sent a direct link to watch this again later. If you'd like, it will also be made available online on CFC's website, YouTube, and Facebook. And last but not least, we are encouraging everyone on this webinar today to please ask questions if you have them. There is a GoToWebinar questions button where you can type in your questions for any of our speakers, and we ask that you please send these questions for each speaker when that speaker is on the screen. After each individual segment, we'll move on to a live Q&A session with each of them. So now let's get started. We do have a lot to cover today. Our first speaker is Dr. Daneshmand, an internationally recognized fertility specialist with extensive experience in providing third-party reproductive services. Dr. Daneshmand serves on the board of several surrogacy advocacy groups. He has collaborated to develop in vitro fertilization protocols to improve pregnancy rates, including PTEC, post-thaw extended culture, which is one of the most successful IVF regimens currently available. These groundbreaking findings were published in the internationally respected medical journal Fertility and Sterility, where Dr. Daneshmand also served as a reviewer. He completed his fellowship and residency at UCLA. He is specialty board certified in obstetrics and gynecology and subspecialty board certified in reproductive endocrinology. Dr. Daneshmand has an experience in complex IVF cases, and his research has featured work on endometrial receptivity as a way to maximize the probability of success during IVF. He is internationally recognized for his experience in egg donation and surrogacy, and is one of the main providers on third-party care in the United States, with patients traveling from more than 40 countries in 2018 alone. I'd like to welcome Dr. Daneshmand.
Thank you so much, Jordan. Hello, everyone, and I hope wherever you are, you're healthy and safe. And during these times of confinement, it's good to be with you and answer some of your questions and concerns.
Thank you. I'd like to start off with the first question we have here. How are clinics managing with clients wanting to get started while being closed?
So there are 2 factors here in regards to clinics. One is that most clinics have put a hold on embryo transfers. And the reason for that is it's because we're trying to get more information, more research published in regards to the health of the pregnancies. At this particular point, there's no evidence of vertical transmission or other significant problems during a pregnancy with COVID-19 transmission. But basically, it's a temporary hold on some embryo transfers that we hope will restart again in a few weeks once the situation is more stable and once we've sort of seen that inflection point. In regards to in vitro fertilization and IVF, many clinics, maybe many private clinics, are continuing to perform in vitro fertilization cycles. And the reason for that is because there's no evidence that the virus can be transmitted via sperm, eggs, or embryos to the fetus or to the pregnancy.
Thank you. Now, is there any evidence of vertical transmission of virus from the pregnant mother or surrogate to the fetus?
At this particular point, we don't have any evidence for that. The best study was published in a journal called Lancet, where they followed a group of patients who were pregnant, who had actually were admitted to Wuhan University with evidence of pneumonia. They later tested them and were verified to have COVID-19. They followed those patients who all delivered via cesarean section. They looked at amniotic fluid, they looked at cord blood, and then once the newborns were born, they looked at nasal and oral swabs for the virus, and they did not find any evidence of the virus. Now, more recent reports also, and this is a report that just was published just about over a week ago. There have been some recent reports of some newborns having the COVID-19. In fact, 3 in particular from Wuhan University who had COVID-19 type symptoms. All of them had a very speedy recovery. They were diagnosed about 2 to 4 days after birth, meaning that they did the testing on them and they turned positive about 2 to 4 days after birth. And after 7 days, all of them tested negative. All of them recovered. They all had mild to moderate symptoms. And the thought process there was that perhaps these newborns were infected after birth. No evidence of vertical transmission, but potentially after birth, either by close proximity to their mothers or to some of the healthcare workers and healthcare providers in the hospital that were taking care of the children. So at this particular point, we don't have any evidence of vertical transmission. And this is in line with many of the other viruses, other coronaviruses, other rhinoviruses, where we don't see evidence of that vertical transmission. However, having said that, these are not definitive studies. Each day, each week, there are more studies and more research and more findings. And so we're monitoring the situation very carefully. And I will certainly give all of you updates. I had posted something on my Facebook page, but I'll keep you updated as to the publication of newer studies.
Okay, thank you. Now, can the newborn have an infection if exposed to someone who has COVID-19?
We definitely have evidence for that, yes. If a newborn is exposed to COVID-19, respiratory droplets, the way this particular virus spreads is either through respiratory droplets. So if somebody is coughing, for example, these droplets get aerosolized in the air, and then somebody can breathe them in. That's how you potentially can get infected. And the secondary mechanism is by fomi transmission, meaning that this particular virus can last for hours and sometimes days on particular surfaces. It looks like plastic and stainless steel. The virus lasts on those surfaces much longer than it does, for example, on cartons. So a newborn can have COVID-19 infection if it's exposed, but it appears so far that children under age 10, including newborns, have very mild symptoms and seem to recover fairly quickly. That seems to be the case, and this is mainly based on all the studies and data that we have from China. In fact, less than 1% of the cases in China were among children under the age of 10. And the overwhelming majority of them had very mild to moderate symptoms. A minority had moderate symptoms. That is not to say that a child cannot have severe symptoms or even a fatality. But among those who had very severe symptoms, when you look at the Chinese data, among those who had very severe symptoms and were hospitalized and were on ventilators, all of those children had underlying medical issues, such as leukemia, hydronephrosis, kidney issues. So that's the good news. Unlike the influenza virus that can affect children to a significant degree, this virus seems to have a different, milder effect on children under the age of 10.
Thank you. What are the risks to surrogate, pregnancy, and fetus if the surrogate becomes seriously ill with COVID-19 while pregnant?
That's a great question. If a surrogate or a patient who's pregnant has COVID-19, and it's a severe case of a COVID-19, meaning there's pneumonia, there's fever, there's hospitalization, and possibly requires respiratory support by a ventilator, then there's some evidence that in the first trimester there may be a slightly higher risk of miscarriage. There's also some evidence that there may be a higher risk of preterm delivery. There was a recent report actually just published about 4 days ago that showed that if a particular patient were to have COVID-19 pneumonia and had significant respiratory difficulties, that may decrease oxygen concentrations in the placenta, which then may affect growth or cause growth restriction in the fetus. It's important to note that in all the cases where pregnant patients had severe COVID-19 and pneumonia, the problems with the few problems that there were with the newborns were related to premature birth and the condition of respiration and lower oxygen concentrations, and not related to the infection with COVID-19. The good news is that pregnant patients don't seem to be more prone to this particular virus, and much like other younger patients, they seem to have, most of them have mild to moderate symptoms. So it's only a very small percentage of patients that end up having severe. As you know, based on the data that we have so far of over 90,000 cases, 80 to 85% of cases are mild to moderate. In fact, we just learned today, for example, Boris Johnson, the British Prime Minister, has been diagnosed with coronavirus, and he apparently has some mild symptoms. He was just recently diagnosed, I think, today. That is the case with most younger patients without any underlying medical conditions.
Do pregnant patients have a higher risk for contracting the virus?
Great question. As we just discussed, no. Pregnant patients don't seem to have a higher risk of contracting the virus. But I do think that, and this is something that we've been informing our surrogates and recommending to our surrogates, to our pregnant patients, do take all the precautions. If you can, stay at home. All the precautions that all of us are taking, I think, should be almost doubled with patients who are pregnant, just to be on the safe side. But there is no evidence that the pregnant patients are more prone to having this particular virus.
Okay. Now, if pregnant patients become seriously sick from the virus, which treatments are available, and are they safe to take during pregnancy?
That's a great question. So currently there are two treatments that are being evaluated. One is in clinical trials, and that's a particular medication called remdesivir. Remdesivir is a medication that's actually been developed by a particular company, a biotechnology company in the United States. And right now there are 5 ongoing large clinical trials on this particular medication for all patients, including pregnant patients. Right now, the clinical trials don't include pregnant patients, but this particular company has said that if the clinical trials show efficacy, meaning that the medication is effective, and it seems from preliminary reports it is very effective in combating severe COVID-19 cases, that the pregnant patients will actually have an advantage in being able to obtain this particular medication. We should have the early reports of these 5 clinical trials, 2 of them at least, in early April. So within the first 2 weeks of April, I'll give you an update on these particular clinical trials. But the company has also said that pregnant patients are a priority for them, and they'll provide the medication at compassionate care prices for patients who are pregnant. The other medication that's actually currently available, but it has been classically used for the treatment of malaria, is medication called chloroquine. That's also being tested. In Europe, in fact, it's been used for patients with severe symptoms. And the good news with chloroquine is it's available now, and it's safe to take during pregnancy in the first, second, third trimester. There doesn't seem to be any effects on the fetus, on the pregnancy. So that could be another very good sign that if chloroquine happens to show good efficacy, that we actually can use it during pregnancy.
That's great, thank you. Now, do you know what the prospects are for possible vaccine?
That's a great question in regards to the vaccine. So the first vaccination trial started last week, and that's on 45 patients in the Washington State area. So far, actually, one of my colleagues is one of the organizers of that particular clinical trial and works for the company. It's actually an NIH-backed trial, 45 patients. So far, this particular trial is just looking at whether the vaccine is safe and whether the patients are going to have any significant side effects from it. So we call that a phase 1 trial. Phase 1 trial is all about safety and side effects. If those patients do well, and we'll know in the next 3 months, then the next phase will be a larger, much larger group of patients who will get the vaccine, and they will combine the phase 2-3 trials, meaning they want to know if this vaccine is effective, and they want to know it as soon as possible. So the second phase will start in about 3 months, and then about 6 months after that, we'll know if the vaccine is effective, and then it should be available on a large scale to patients. It's important to note that worldwide, there are 40 different countries, including the US, Canada, countries in Europe, in Germany, that are working on the vaccine, and they're working night and day. Really, I have a great deal of faith in these researchers. They're committed to finding the most effective vaccine for this particular virus. The other good news is that this particular virus, which actually has about an 80% homology, or its DNA sequence shares 80% of its DNA sequence with the SARS virus. The good news is this particular virus doesn't seem to mutate as much. So we think that if the vaccine is developed, it's going to be much more effective than, for example, even the influenza vaccine or the SARS vaccine. So that's another ray of hope, which I think is really bodes well for the future.
Okay, that's wonderful information. Another question here. If I match with an egg donor, can you proceed with freezing the eggs until we can freeze the sperm at your center, given the current travel restrictions?
Yes, absolutely. In fact, our lab director was directed by me to share our pregnancy rate and egg thaw, egg freeze data. And our egg freeze and thaw data has been excellent. In other words, their survival rates have been about 93%, and we've had about 65% of fertilized eggs reach a blastocyst stage, and those that we transferred, over 80% reached a pregnancy. So the results are excellent from frozen eggs. In fact, we're one of a few clinics in the United States that are certified for egg freezing by an egg bank, the most prominent egg bank company in the United States. There's only a few clinics that are certified that way, and you have to show very high rates of survival and very solid, very excellent pregnancy rates in order to be able to be certified by this particular company. So we feel that if, for example, intended parents have been matched with their egg donors, if because of travel restrictions or other reasons in regards to COVID-19, they're not able to travel for the sperm freeze, then we can actually go ahead and retrieve eggs and freeze eggs until the time when the sperm is available. So the success rates are excellent in regards to that. We're also looking at many other options for sperm freeze in different locations for our intended parents, and of course, I'll keep you updated on that as well.
Okay, amazing. Now, what precautions are you taking at your fertility center to limit exposure to the virus for both patients and staff?
We have to do our part in regards to social distancing, in regards to keeping the safety of our patients, our egg donors, our surrogates at top of mind. So what we're doing is we're starting off with a screening procedure before anyone's allowed to enter the office. There's a questionnaire in regards to recent travel, in regards to any signs or symptoms of COVID-19, for example, cough, fever, any kind of symptoms. And unfortunately, if patients do exhibit those symptoms, or if they tell us about those symptoms before they enter the office, they're not allowed to enter the office until those symptoms completely resolve, until that 14-day quarantine period is over. That's one. Number two, we are sort of abiding by the social distancing. So what we've done is we have increased the spacing between patients. So we're not seeing many patients at one time. That means longer hours for us sometimes, but again, I think that that's one way to maximize the health of our team members and of our patients. And then, of course, everyone in the office is wearing masks, gloves. We're actually disinfecting all surfaces several times a day. We always do it in between visits for patients, but we're now doing it overall, and countertops and areas in front of the front desk and other places with disinfectant Lysol, which is very effective against the virus. So we are doing our part to make sure that we maximize the safety of our patients and our team members.
Okay, amazing. Thank you for all of the incredible information. We do ask that if anyone has any questions for Dr. Daneshmand, that you type them into the questions tool now. We have quite a few that have just come through, so I will get started. The first question is, what is the process and or requirements and possibility for Canadian surrogates to come down to San Diego Clinic for embryo transfers and have babies delivered in Canada right now?
Well, I mean, at this particular point, we are dealing with some travel restrictions. We hope that those travel restrictions will ease as sort of we reach these inflection points in the viral transmission. And I think we will, because of the fact that both in Canada and the United States, we're really adhering to these social distancing recommendations that are given by the governments. So we're hoping those travel restrictions will ease. There's also a possibility that for screening purposes, we may be able to do some screening tests locally as we're waiting. But again, the hope is that we will sort of reach the inflection point in viral transmission somewhere within the next 2 to 3 weeks and have a much more stable or declining number of new cases every day, in which case then I think that governments will feel more comfortable easing restrictions for travel. We'll also be providing support documents, support statements for our intended parents who are, for example, need to travel because of impending deliveries. So we're doing everything, and I think with great team support from CFC, from attorneys Ellen and Rachel, our colleagues in Canada, we're all working together as a team. And I think this is a team effort to take care of our intended parents. And I'm very proud and honored to be really a part of this great team.
Amazing. Now, another question here is from someone thinking about becoming a surrogate. They're asking, can I still be a surrogate while coronavirus is happening? And so how can she prevent herself from getting it while she's pregnant?
Well, I think, all the social distancing recommendations, the answer is yes, she can still be a surrogate. Remember that in order to be a surrogate, there's multiple steps, so we can certainly start the first series of steps. The first step is really to contact CFC, and then after that, we will need to review medical records, for example. Then after that, we will schedule screening. So there's lots of steps until the time when a particular surrogate's ready for embryo transfer. Just adhering to all the social distancing recommendations, really just taking care of yourself, making sure you wash your hands on a regular basis, minimizing, touching your hands to any surfaces and then touching your face, because that's how this virus gets spread, either through respiratory droplets in the air or through touching a particular surface and then touching your face, eyes, mouth and nose, and that's how it gets spread. So I think understanding how the virus is transmitted and then taking precautions to protect yourself is really the best way. And that goes for not just pregnant patients, but everyone. Because the virus reacts differently in different patients. So again, we want to make sure that everyone is protected.
Okay, thank you very much. Now we have so many questions. think we're going to be able to get through all of them. So what I'll do is we'll finish this up here. We'll make sure to answer all of the questions when we send out this webinar link by email afterwards, and we'll have this information on our website too. Does that sound okay, Dr. Daneshmand?
Thank you so much. That'd be great. Absolutely, my pleasure.
Yeah.
I'm here to
Okay.
answer all the questions and concerns.
Okay, that's amazing. Thank you so much. So we'll say goodbye, and next up we have Embury and Rachel West.
Hello, everybody.
Thank you.
Hi.
Hi
there.
Rachel. Hi, is Ellen here?
I am here if you can hear me.
Okay, wonderful. Yes, thank you. Okay, we'll get started. So thank you both for joining us today. For everyone here, so Ellen, we are Western Canada's leading team in the area of surrogacy and fertility law. Ellen has been practicing as a surrogate and fertility specialist in Canada for 20 years. Rachel has been practicing law in Canada for 14 years. Ellen and Rachel have worked together. Ellen and Rachel have helped thousands of couples and individuals of all backgrounds and sexual orientations to become parents. They work with intended parents, surrogates, gestational carriers, egg and sperm donors, and also with physicians and clinics across Canada and the United States. Ellen is regularly asked to lecture on surrogacy and fertility law across Canada and around the world. Rachel travels regularly to meet with international clients in their home countries, with a particular focus on France as she is fluent in French. Ellen and Rachel pride themselves on delivering caring, cost-effective services to all of their clients, both domestically and internationally. Now, Ellen, first few of our questions are for you. So I'd like to start off with asking, is Canada still a safe place for surrogacy?
Thank you. And I do apologize for not being there on video. We had some technical problems. In terms of whether Canada is safe, my response would be absolutely. Canada is certainly a safe jurisdiction to come to for your surrogacy journey. Our government in Canada has responded very quickly and very proactively to the situation involving COVID-19. When we had borders shut down last week, a group of lawyers became concerned about getting parents into the country, and by working together, we explained to the government that parents must be here for their children's births. It did take us about a week, but we now have a process to get those parents here for their children's births while the borders are shut. And so certainly everybody expects that this pandemic, while terrible, will, in a perfect world, die down in a matter of weeks or a couple of months. And there's no reason to think that as a result of this, that Canada is not a safe place to pursue surrogacy.
Okay, thank you. And is Canada still a safe legal jurisdiction?
Well, I think that that's the question. Yes, nothing has changed about Canada legally. Sorry, I don't know if Rachel wanted to jump in there, but nothing at all has changed about the legal ability to become your child's parents immediately at or after the birth.
Precisely. So the foundational legal system remains the same. It is still a safe and regulated place to engage in a surrogacy journey. And our laws are in place. Our government is involved in surrogacy, and it is legal and safe here to proceed. Without question of COVID-19 and what kind of challenges that places on top of surrogacy. As Ellen pointed out, we have a team of lawyers now across Canada. All of the fertility and surrogacy lawyers are working together with the government of Canada, who is aware of intended parents trying to get into the country and other related issues. We are working on solutions together. And in fact, within about a week, we had a positive response from the government to create a pathway for individuals to come into the country to get their babies. The government has recognized that an exemption is needed for the border closures. So it's been a very, very quick resolution. And I would say for that reason, it is an even safer and better jurisdiction to be engaging in surrogacy.
Well, thank you, Rachel. Another question for Ellen here. In light of COVID-19, should intended parents wait this out before they start the surrogacy process?
So the answer to that is that there are inherent delays involved in the surrogacy process anyway, particularly if you need donated eggs, if you need to create embryos. In my opinion, if you already have embryos, whether they are in San Diego or whether they are at a clinic in Canada, or perhaps whether they are overseas, now is the perfect time, really, to match with a surrogate and to get to know the surrogate with the goal of moving forward once restrictions are lifted. If you do not currently have embryos, I think that now is the time to think about where it is that you want to create them and to get started on that process. Whether you are proceeding with a US clinic, Dr. Daneshmand's clinic, who I know has lots of donors, or in Canada, now is the time to get your donor selected, and so that, because there's typically a 4 to 6 week wait there anyway, and with the idea that you can move forward as quickly as possible once travel for elective procedures resumes.
Thank you. Now, will the existing insurance policy that intended parents purchase to cover their baby's health care be valid during the COVID-19 pandemic?
Yeah, this is Ellen speaking again. That is a question that we're getting a lot. So most of the, and I'm noticing from the people who have subscribed to this webinar that we have some in Canada and we have quite a few from overseas. So this will not apply to those of you who live in Canada. For those of you who are coming from overseas, you would have been advised to purchase insurance, which will cover the healthcare costs of your newborn baby. And the vast majority of you have purchased or intend to purchase insurance from Allianz Worldwide Care. My office reached out to Allianz a few days ago, and I asked, well, what is the situation on coverage? The answer that I received via email was that if people are coming from Europe to Canada for pleasure in the face of border restrictions, no. If they were to get sick, that would not be covered. But if the purpose is to visit immediate family members, then the answer is likely yes. And of course, in my opinion, there is no clearer definition of an immediate family member than the child who's going to be born here. But I have followed up with Allianz, and I've asked for a supervisory opinion in writing, which specifically says, yes, those intended parents who are coming to Canada for the births of their babies, the only reason that they have that insurance is to cover their baby's healthcare costs. Can they confirm that notwithstanding travel bans, that will be permitted? And we are expecting a response any day, but my expectation is that they will say yes, understanding that they know that this was the only reason that insurance was purchased in the first place.
Thank you, Ellen. That's really great information. The next few questions we have here are for Rachel. Now, Rachel, can an intended parent ask their surrogate to stop working and stay home to protect their baby's health due to COVID-19?
Thanks for that question, Jordan. Yes, so a parent or intended parents could ask their surrogate to stay at home or stay away from the workplace in order to protect her health or the health of their baby. That is certainly an option available. However, intended parents need to understand that there are potential financial consequences of requesting that a surrogate stay home and cease work when she hasn't been asked to do so by her employer or by the government of Canada. So in that circumstance, it is very important that under our laws and legislations here in Canada, any stoppage of work is as a result of a medical need to protect the surrogate, to protect the baby. And so in order for her to be entitled to reimbursable expenses, reimbursement of wages, we would need to see a doctor's note saying that for the protection of the health of her or the baby, that she was required not to work anymore. But obviously that process could be triggered by the intended parents requesting that she seek such a letter. But again, there is a financial piece to consider in that equation. So if your surrogate is remaining at home at your request in order to protect her health or the health of the baby, in those circumstances, you would see that intended parents should be paying wage loss, the difference between what she would otherwise be earning and what she is able to earn through any wage benefit programs.
Okay, great, thank you. Would you be able to touch a little bit more on how exactly wage loss or bed rest expenses work during COVID-19?
Sure. So they're going to work in exactly the same way that they normally would, which is that surrogates are entitled to request their reimbursement of their wage loss. So we would look at what would you normally be earning, but for the fact that you are no longer working, and then what wage benefits are available to you as a result of the current situation. So for instance, here in Canada, we have employment insurance, which it provides a wage replacement benefit, not all the way up to 100%, but a portion of lost wages would be reimbursed by the government of Canada. And so we would be looking at what would you be earning? What have you been able to receive through other benefit programs, either through disability through work or employment insurance, or the other programs that have recently been put in place by the government of Canada. And then the intended parents would be paying the difference between the full amount and the amounts that she is receiving through other mechanisms.
Can I just jump in on that? Can you hear me, Jordan? Yeah. So the one question that we are getting frequently is, well, what if my surrogate is laid off by her employer? We are seeing temporary layoffs in Canada as a result of COVID-19. And it is important to note that if the reason that she no longer has a job is not related to a medical condition, it's not related to medically ordered bed rest, but rather it's related to the fact that she was terminated from her job along with a group of other people. In those circumstances, the intended parents are not going to be responsible to cover the wage loss.
Correct. And so all of this, the wage loss obligations of intended parents are triggered by a doctor's note, which says that the surrogate cannot work. And so if there is no doctor's note which says surrogate cannot work in order to protect her health or the health of the baby, she is unable to access intended parent top-up. So she would only be entitled to those benefits that are available to her otherwise through EI, employment insurance, or other mechanisms or other programs that are currently available. So again, the triggering mechanism is always going to be the doctor's note, which says this stoppage of work is for the protection of the surrogate or the baby.
Thank you both. We have another question here. Now, what if an intended parent lives in a country that is currently locked down? Are they still able to travel here?
It's a good question and not one with a very simple answer. So, as we've touched on, as Dr. Daneshmand touched on, this situation, COVID-19, is evolving on a daily basis. We're getting new news, new information every time we wake up virtually. And so what that means is that we're not always we're giving you information as of today's date, but that may change as of tomorrow's date. But in my view, there is sort of a three-step question as far as intended parents leaving countries other than Canada and coming to Canada. The first question is, do you need approval from your government in your country in order to exit your country? And we are finding that in certain jurisdictions, Australia is one example, the government is actually requiring Australians to make an application to leave the country before we even address the question of arriving in Canada. The second step of the question is arriving in Canada, how do we obtain those exemptions? And so as Ellen pointed out, and as I alluded to, we have worked with the government of Canada to create exemptions for intended parents entering into the country. Right now it's to pick up babies that are being born, but we will be working on those exemptions. So there is an application process at the moment. So we would make a court application or a desk application requesting that exemption, and then hopefully we would obtain it and you could both leave your country and enter Canada. The third step is obviously going to be flights, which are limited right now, and that we can't assist too much with, but we certainly hope that as things get back to normal in the coming weeks, there will be international flights and we can assist you in getting here as soon as possible.
The one thing that I would add to that is that I think that for now, the ability to travel to Canada is strictly related to if you have currently got a pregnant surrogate. My expectation is that it will not be likely that you will be able to travel to Canada to, for example, donate sperm, create embryos. That will be after the borders are open again. And I would imagine if Dr. Daneshmand is still with us, that's likely still the same case in the U.S. as well.
Yeah, so right now it's trying to get intended parents here to collect babies, but as I said, in the coming weeks, hopefully as things normalize, then we can get back to bringing people into the country for reasons other than that immediate issue.
Thank you, both Ellen and Rachel. We do have some questions coming in from some intended parents on the webinar today. One intended parent is wondering, so their surrogate is a part-time employee and is not entitled for EI. So if she has a doctor's note, will the reimbursement be part of her monthly reimbursement?
So I can speak to
Rachel,
that,
why don't
Ellen,
you take that one? Yeah.
Okay. So a lot of the questions that we're going to see today are going to be answered in the contract, and so we cannot always give you a specific answer because I'm not sure what your contract says in respect of inside or outside the cap reimbursements for wage loss. The first thing I would say is a part-time employee is not automatically ineligible for EI, and so there is likely another reason why she's ineligible for EI. However, I will say that there are current changes to the EI program that are occurring every day that create eligibility for people who previously were ineligible. And so the first step would be to examine those additional programs and see whether or not there's some eligibility there where we previously thought no. The second answer is, unfortunately, you would have to look into your contract. Normally, what we see in contracts is that wage loss as a result of a doctor's note would be outside the cap, outside of the monthly expenses, if you want to talk about them that way. But again, I can't answer that specific question in relation to a contract that I'm not familiar with. Okay, Ellen, is there anything you want to add to that?
No.
Okay.
Okay. Another question here from an intended parent. So they're mentioning how many hospitals and birth centers throughout Canada are imposing a one support person policy for those giving birth right now. In a surrogacy scenario, this often means that neither the intended parent is granted access to the building during and after childbirth. Usually it would be the surrogate support person, for example, her husband. So how are intended parents being engaged during and after the birth right now? They're saying that it seems to be an ethical and legal liability.
So I can speak to that one. It's Ellen speaking. So the approach that we are taking, it's a two-pronged approach. Number one, we always have to remember that legally, the surrogate is the only person who decides who's in the room with her at the time of birth. That has not changed. That was the same pre-COVID-19 and after COVID-19. The way that we are approaching this with hospital births right now is that we are advising all of our clients to work with their lawyer and the hospital, but it is critical to be completely respectful of hospital policies to ensure that hospital policies are followed. And what that means is that yes, it is possible that right now, during this time frame, you may not be present for the birth of your child. I am personally working with 2 different hospitals with 2 different upcoming births. And the process that we have worked out with those hospitals is slightly different. In one case, we expect that the intended parents will be in the cafeteria, and as soon as the baby is born, because the surrogate would prefer to have her support person there, the support person will leave and will be replaced by the intended mother who can look after the child. With the other hospital, which is a more rural hospital, we're finding it's a little more flexible, and it does look like we will be able to get one of the intended parents in at the time of birth. So really, the short answer is, in this time, we have to be respectful of policies. We have to understand why they've been put in place. It's to protect all of the other people in the hospital. It's to make sure, we want to make sure that baby is discharged as quickly as possible. And not to make light of it, I really don't want to, but I do find myself saying to clients, you will be raising this baby for the next 35 years. If you are not in the room at the moment of birth, that is not going to minimize the fact that you will still definitely be the parent of this child very quickly.
And just to speak to the legal issues, so what Ellen and I are presently doing with births that are happening in the coming weeks is we are drafting letters. We've created letters for hospitals explaining that even though the intended parent may not be in the room at the time of birth, that parent is still the parent and therefore is responsible for making the healthcare decisions for the child. And so that they have those necessary rights, and so that the hospital understands that immediately upon birth, the intended parent is the one who is making those potential decisions following delivery.
Great. Thank you both. We have a ton of questions coming in. I think we have time for one more. We have quite a few people asking if Canada is imposing a quarantine period once they arrive in Canada. They are wanting to know, should we be booking a hotel, or will the government leave us all together in a hotel dedicated to people outside of the country? What do you know what's going on there?
We don't really know. So this is information that is rolling out very, very quickly again, and we're being updated on a regular basis. But yes, we are informed that the plan now, in order to enforce post-arrival quarantine, is to either A, ensure that an individual has a place to go to and understands that there are penalties now in place if they do not quarantine appropriately. But we also understand that potentially there are going to be hotels or meal delivery, provision of accommodation and food for individuals who are into forced quarantine. But the details of that, I don't believe, have been appropriately worked out to the extent that we can communicate those to you. Unless, Ellen, have you been checking the news while we've been on this webinar? Is there any new information on that?
The information that we have is that you are only now allowed to land in 4 places. You may land in Vancouver, Calgary, Toronto, or Montreal. If you have a connecting flight from one of those 4 cities, you will not be allowed to get onto the connecting flight. You will be expected to quarantine in the city in which you landed for 2 weeks. It is if you manage to get to your final destination on the first flight. So, for example, if you are coming to Toronto and your baby will be born in Toronto, it is not clear whether you will be immediately moved into a hotel and asked to quarantine there, or whether if you have proof that you have a place to stay, you'll be entitled to go there. My instinct is that if you can say to them, we have a place to stay, we have proof of a place to stay, it is likely that they would allow you to go there as long as you provide an assurance that there is nobody else in that location. But they are telling people right now, to be clear, you are not to stop on the way, you are not to go to a grocery store, you are to go directly to the place that you intend to stay and to stay there. And of course, everybody has grocery delivery available. So the grocery, let's be crystal clear about this, the grocery delivery is booming right now.
That is very true. Well, thank you, Ellen. Thank you, Rachel. Unfortunately, we do have to move on. Many of you who have asked questions, they are very specific. We will make sure that they get to the right person, whether that is Dr. Daneshmand or Rachel or Ellen. We'll be posting answers on our blog, and we'll be connecting with you after the webinar with a recording and answers for your questions. So now we are joined by Leah. Leah Swanberg is the founder and CEO of Canadian Fertility Consulting. Leah is a mother to 5 and twice a gestational surrogate. She began Canadian Fertility Consulting in 2007 after her second surrogacy, with the intention of creating happier and more rewarding experiences for both intended parents and surrogates. Leah's approach to surrogacy is simple, taking a holistic approach to ensure that all parties are supported, encouraged, and protected. She has made many industry connections and working partnerships with professionals worldwide to ensure that she can help to develop the fertility plan that best suits your needs. Having owned Canadian Fertility Consulting as well as founding Egg Helpers. She still has many connections there, helps on a daily basis, and also runs fertility advisors. Thank you for joining us, Leah. The first question that I would like to ask you is, how are surrogacy agencies supporting surrogates during COVID-19?
For many agencies, we are putting heavy emphasis on support and encouragement, education for intended parents, so that when they reach out to their surrogate and they share their concerns, that they are based in fact and not sort of the fake news that's floating around. And so for us, we want to ensure that the relationship with intended parents and surrogates is really insulated throughout this process, and that our approach is one that is based out of love and not fear. So when we talk to intended parents, we really encourage them to reach out to their surrogate, stay very close and connected during this time, and to really express their deep commitment and thanks for the surrogate, ensuring that she's taking all precautions, that she is practicing hand washing, that she is, practicing what we really call physical distancing, because we want to still be social. We still want the surrogate to be connected to other surrogates within our online communities and, ourselves. We're also really, as an agency, and I imagine others are doing this as well, ensuring that the surrogates have access to our on-staff counselor. So we want to make sure that as this time of sort of heaviness and anxiety for many occurs, that people have someone to speak to, and they have someone to really share their concerns with, and to really move through the heaviness into what we hope is a place of hope, as we see Canada really doing a great job at limiting the spread and exposure of COVID-19.
Amazing. Now, we would like to know, are there currently surrogates available?
We have been just inspired. Like, that is the only word I can come up with. There was a clip going around, and it was Mr. Rogers saying, when I was a child, my mother said to look for the helpers. When there was sad news or bad news, to look for the helpers. And we are just amazed because the helpers are showing up. We are seeing women sign up, women contact us, women wanting to help, give hope to people during this time that for many just sort of feels, like, as I said earlier, heavy. And so there are definitely surrogates available throughout this time. And, it gives a good lead time. We know that for the next, month or two, clinics will likely remain closed. And, for any of you who are interested in surrogacy on this webinar, surrogates, know that this will give you time to get to know your intended parents on a deeper level, because there is more time to relationship build as we lead into, moving forward with clinic appointments and the rest that comes with it.
Leah, could you tell us, what is the current wait time of surrogacy?
Sure. So our wait time hasn't actually shifted in this past month, which surprised even me. So generally speaking, a wait time is 6 months, sometimes up to 9 months, depending on the type of surrogate that you're looking for or the location of said surrogate.
Okay, thank you. Now, another question here. If an intended parent is unable to get into Canada, will their surrogate take care of their baby?
Sure. So every case that we've had so far, a baby coming imminently, so within a few weeks' time, all of those intended parents have arrived. They have all been able to enter Canada. They've all self-isolated or self-quarantined for 2 weeks. So the evidence is there that intended parents will be in Canada for the birth of their child, as they would be without a COVID-19 exposure or pandemic. But what I will say about that is that, babies have their own plans. So babies have come early. We've had surrogates caring for the babies or the baby in one case. And we are suggesting to intended parents that they come a little earlier. You know, we know that they will be required to self-quarantine for 2 weeks. We know the average IVF baby, or in our program, the average surrogacy baby comes at 37 and 5. So when we look at that, that information tells us that parents need to plan to be here at week 35 of their pregnancy. And from there, you know, self-quarantine where you land, travel to your surrogate's location so that you can be available to your baby as soon as he or she makes his entrance into the world. Now, of course, you know, we have plans upon plans upon plans, support upon support upon support. You know, we've had members of many communities reach out and say, hey, if there's a surrogate who needs help and support, someone to come and, you know, cuddle a baby, who doesn't love that? But our intention and, you know, our fast action has shown that the Canadian government is keen to let people in to be present for the birth of their child. And I'll follow that up by saying the Canadian government is keen to get people home to their jurisdictions, and we're seeing passports issued, we're seeing you know, people entering, people exiting, and, you know, even amongst COVID-19.
Okay, thank you. Now, we ask that if anyone has any questions for Leah, to please type them into the questions tab at this time. We have a few that have already come in for you. One person is wondering if CFC has any recommendations to have the surrogates stay home. Like, are you recommending they stay home during COVID? What's your perspective on that?
So what we're recommending is that people do evidence-based research. So the World Health Organization has just put out a new pregnancy care plan, which is fewer medical visits, which result in less exposure to other people and, you know, potentially to this virus. So we're suggesting surrogates follow that. In terms of whether surrogates are working in the community or not, we're really relying on employers who are following Health Canada's guidelines and recommendations to ensure that they are, you know, keeping women safe. And for some, that's working from home. Our team is all working remotely right now. And so we really rely on employers to make that decision, and we of course will support any surrogate who maybe has questions about that. We work with amazing lawyers, you know, Rachel and Ellen being a couple of them that work in employment law, and so if a surrogate has questions, we're happy to relay them or introduce them directly to ensure that, you know, the women in our program are being appropriately cared for by their health providers as well as their employers.
Okay, thank you. Now we have quite a few people asking, do you know the timelines on this? Do you know when we'll be able to transfer again? Do you have any expectation on how long COVID-19 is going to last?
So it's interesting because we talk to fertility clinics every day that right now are you know, meeting with clients by telemedicine, so by the phone or Skype or Zoom. And so what we're suggesting to people is that, you know, for those who have started this process or those who have maybe had failed transfers and are waiting to get started again, you know, to book a call with your physician, book a call with your nurse, to really ensure that the moment these clinics open, that you are at the front of the line, that you are knocking on the door, that they know you are ready to proceed immediately. I have heard that, you know, in Canada at least, I haven't really looked into the US clinics, although we have a number of people, you know, working with Dr. Daneshmand, who you heard from earlier. You know, the number that seems to be floating is 60 days, but again, you know, I think it really is going to come down to how well we are able to cooperate with this physical distancing and really limiting exposure and yeah, self-isolating.
Thank you, Leah. It looks like it is now 3 o'clock. We are up for time now.
I'd like to, sorry,
yeah,
Jordan, can I just give like a few tips
yeah,
that I wanted
absolutely. If there's anything else that you'd like to
Sure.
say, please go ahead. Yeah.
So the first tip is don't wait. And that comes to many things. So if you have a surrogate and you're engaged and it feels like a great fit and you want to move forward, get started on your legal contracts. It's so important that that is in place. So when the doors open, we can move forward really quickly with your transfer. Speak to your insurance provider. As there is somewhat of a delay, many of you have purchased insurance that may last 1 year. So ensure that, that you have engaged the insurance company as well. Third, as I said earlier, talk to your physician or nurse and really, ensure that they know you're ready as soon as they're open. And then as well, if you are matched and currently pregnant, now is the time to show up for your surrogate. If you are a surrogate who is currently pregnant, now is the time to show up for your intended parents. And what that means is to really stay close, stay connected, share your concerns in this interdependent relationship that you have. If you are feeling very nervous and very anxious, reach out to your agency. If you're working with us, we can get you booked in with Jan Silverman, our on-staff counselor, to talk through the big stuff, the heavy feelings. Because for us, we know this is going to end because we're seeing it end in other places in the world. We're seeing China recover. And in Canada, we are doing such a great job that we want to ensure that when we reopen the world and when clinics start working, that you are not only medically prepared, legally prepared, but that emotionally, when this heaviness lifts, that you are ready to move forward very quickly in a way that is, full of hope and love and joy and excitement for the future. And so spending that time with your surrogate now, really connecting, really insulated, that is the key. And for those of you with ongoing pregnancies and any questions regarding relationship building during this difficult time, we did a webinar earlier, and Jordan will have that on our YouTube channel and posted on our social platforms on relationship building. And so I would suggest you check that out as well. That's everything. That's all I have.
Okay, thank you, Leah. Thank you so much. That was great information. I'd like to say thank you as well to Dr. Daneshmand and Ellen and Rachel for taking the time to join us today and answer these important questions about the current situation with surrogacy and COVID-19. Now, as we wrap up, I would just like to remind everyone that if we were not able to get to your question, we will be answering those on our blog in a Q&A. We'll be emailing them out directly to you as well, along with a recorded version of this webinar. If you're watching this and it is a later time and you happen to have some questions for any of our speakers today, please reach out by email or our social media pages and we can get those answers for you. Thank you again for joining us today, and we hope everyone has a wonderful rest of their day. Bye, everyone.
Thank you.
Thank you so much.